So the words experimental therapeutics can be quite scary to families.
Yes.
But in fact, we're always experimenting. Whenever we change a patient's treatment plan based on how they respond, etc. But experimental therapeutics is really a catch-all phrase for the next generation of standard of care for treatment. We have to learn in a systematic way how our treatments affect patients, and that's with experimental therapeutics.
Well, talk to me more about what's going on at the hospital then.
Oh, there's a lot of exciting things that are going on in our division and in the hospital in general. We offer some clinical trials for patients that are not offered anywhere nearby for 300, 500 miles from here. And that is because we all work together. We work in consortia to pool the best resources from all around. We have studies where we can take out a patient's tumor, have it be looked at a molecular level, and understand that patient's tumor, and then target the therapy specifically for that patient. And this is all still experimental, but we have a number of patients from all over the country that have come to participate in these studies at Penn State Children's Hospital.
And of course, we've been talking today about how THON is kicking off. How big of a deal is that? Four Diamonds
Yes.
and THON. How does it play such a big role in what you do?
It's a huge deal. Without THON and Four Diamonds, my program would not exist. The research is being done, the cutting edge research would not exist. And we cannot thank the students and Four Diamonds enough for allowing us to do what we do, and that's giving hope to the hopeless.
And let's talk about clinical trials. Are all pediatric cancer patients entered into clinical trials?
We do our best to offer patients participation in clinical trials if they are eligible. So there are very specific criteria for patients to participate in trials because one size does not fit all. So we are very cognizant or aware of trying to get patients on trials, because the bottom line is that 60 years ago, all pediatric patients with cancer died. But I can say in 2017, that's a much better statistic, whereas 4 out of 5 will survive and grow up and have their own children and have thriving, fruitful lives, and that's our goal for 100% of children with cancer.
You said you hope someday you go out of business, that
Yes.
there will be no more childhood cancer.
That's right. I would love that we could just fold up shop and not have an experimental therapeutics program, or focus on trying to minimize the long-term effects of what we need to do to cure a child. That would be the next step.